My top lip was touching my nose. And it was then that I started to realise just how much pain I was in, that it felt like a burning, throbbing, pulsating feeling. And it was as if my lips were just seconds away from bursting.
Rachel Napier is one of thousands of people in the UK who's had dermal filler injections, the cosmetic treatment which adds volume to the face. But for Rachel, the procedure she had at a friend's house by a beautician went terribly wrong.
The filler had been injected into an artery, and it's the artery that runs from the centre of your lip, sort of up here, so it was causing a mass blockage. Left untreated, that leads to necrosis, which is the death of the soft tissue on your lip. That's irreversible damage.
Rachel was able to find a clinic that could dissolve the filler and fix her lips. She's one of a growing number of people who've had fillers in the UK. But in an industry which is currently unregulated, what can be done to protect patients and avoid mistakes happening? Does unregulated mean unsafe?
Fillers can be injected by healthcare professionals like doctors, dentists and nurses, but they can also be administered by those not subject to regulation, like beauty therapists. While there are registers for practitioners, they are voluntary and not compulsory. Doctors and campaigners say this is putting people at risk.
Rachel's filler was performed by a beauty therapist who incorrectly inserted the needle into a blood vessel.
I didn't really understand the difference between medics, non-medics, beauticians, dentists, dental nurses. I didn't really understand how it works and what you need to be qualified to do.
Save Face runs a government-approved national register of accredited practitioners. The number of complaints they received in 2018 about botched fillers more than doubled compared to 2 years earlier. And in a survey for ITV News, we found that out of the practices who responded, the most common work they corrected were lip fillers. It made up almost 70% of all corrections. Almost half the work they corrected had been carried out by beauty therapists, but a quarter had been carried out by healthcare professionals like nurses and doctors. The British Association of Aesthetic Plastic Surgeons are calling for tighter regulation in who can perform injectable treatments. Nora is a spokesperson for the association and is a plastic surgeon. She showed us what could happen if fillers were wrongly applied.
Some of the higher risk areas for travelling back to the eye are here and here, and that's because of the way the blood supply of the face is laid out underneath the skin. In terms of problems with tissue blood supply or even blindness, actually here and here are the more higher risk areas, although any facial injections do carry that risk. To perform an invasive procedure, which any injectable treatment is, a person at the very least should have some medical training. Dermafillers are not prescription items and are not tightly regulated, so we have non-medically trained people who do not work in the healthcare field at all, performing these treatments, and that's simply wrong and dangerous.
Adverts online promote courses training people how to administer injectables like dermal fillers. Many courses are available to non-medics. But is it fair to say non-medics can't provide safe treatment? Maxine runs this training provider in Manchester. She says students leave with the appropriate knowledge and skill required for injecting fillers.
When they do come, they come for 3 days of training. They do a minimum of 10 to 15 models. So that's live demonstrations and also practical models, as you can see here today. So adverse effects and complications is one of the biggest modules that we cover in our training. We recognise that as a non-medic doing treatments, that you need to be able to recognise if something serious happens. We actually include that in our training.
But the Joint Council of Cosmetic Practitioners say that this level of training is not high enough to carry out these types of treatments. In 2018, it banned beauty therapists from joining its filler register. It only allows those with medical training to be on it.
We've wanted standards to be raised, also to work alongside the framework that was released by the JCCP, but they've actually pulled away from beauty therapists. So where does that leave the beauty industry? I do think that there needs to be regulations. The councils need to do inspections of premises and training providers also. The industry, I'd say at the moment, is at crisis point.
Rachel is now campaigning for tighter regulations for fillers, asking for the help of her local MP.
I've come to talk to you about what happened to me when I received some Botox and filler, and really about the wider issue of the consequences that can happen for visiting these non-medics.
If you look at breast implants, only medics can undertake that because it involves an operation, it involves surgery to undertake that. But with the other treatments, the derma fillers, the Botoxes, there's no requirement. Anyone can do that. I mean, I could set up business as a side work to being an MP and administer Botox, and that's clearly ridiculous. And given that this is such a big industry, I think you're right. At the very least, Rachel, we should have a regulatory body that has a register of suitably qualified people for them to determine what qualifications are required in order to administer these products.
He raised the issue with the Prime Minister, Theresa May, in the House of Commons.
I extend my deepest sympathies to Rachel Napier, and we're currently working with stakeholders to strengthen the regulation of cosmetics procedures.
It's not clear when regulation will come, meaning that it's up to the consumer to take care when choosing a practitioner for fillers. The government's advice is to find a reputable, safe and qualified practitioner who is subject to statutory regulation or who is on a voluntary register. But there's questions being asked about how these treatments are being advertised to young people on social media, and concerns raised about how fillers are being promoted to vulnerable people who may not need them. Take a look at our next video where we examine how some clinics are selling what they are calling the Kylie package.